Hello, everyone, and welcome. My name is Corey Thornton. I am the Managing Editor for Market Intelligence at Open Minds. Today, as part of our weekly Executive Web Forum series, Open Minds Executive Vice President Richard Lewis will walk you through how to build a payer pitch deck. But before we get started, we have a couple important housekeeping reminders. With the exception of myself, Richard, and our colleague Chrissy Hoskinson, the audio will be muted during the day's briefing. Chrissy and I will be asking Richard some questions throughout his presentation. But to keep it interactive with you, our virtual audience, Richard will ask you some questions. So please be on your toes, listening for those questions. Use the chat feature in the GoToWebinar to share your responses and comments. Of course, if you have any questions at any time during the presentation, please enter them in the chat and Richard will answer them. Thank you in advance, and let's keep it interactive. The slides and recording for today's briefing will be available on the Open Minds website starting tomorrow. And with that, Richard Lewis.
Thank you, Corey, for that introduction. Appreciate it. Well, hello, everybody. My name is Richard Lewis, and I'm with Open Minds, and happy to be here today to take about an hour to go over the basics of how to build a payer pitch deck, which is something that is very important and has been very important, especially in this last year of the pandemic, when there's been so many market changes that we've all experienced, both on the payer and provider side. We're going to look at a couple of things, and I'll walk you through. First, we're going to take a look at the strategic implications of the new normal. You know, what has changed in the market, what has changed in the landscape over, especially this past year. And I'm going to focus a lot on this past year, especially because of the impact the pandemic has had on health and human services, both positive and negative. We're going to talk a little bit about how to prepare to develop a pitch deck and what a pitch deck is and how we use it. How to do an organization and service line review, and that is taking a look at our core service lines as an organization and determining which service lines may be marketable to health plans, managed care organizations, MBHOs, those types of things. We're going to delve into what a payer partnership concept statement looks like. We've got a mock-up of an actual pitch deck that was developed with one of our clients that we're going to kind of at the end show you in summation, you know, what it looks like and as an example. And then we'll talk just a little bit at the end about once you have a pitch deck, maybe some of the next steps in terms of how to use it and things you might want to do to re-engage plans, health plans when we're done. And of course, Q&A, feel free to ask questions anytime during the presentation, and I'll be happy to answer them. With that, I think the big questions that leadership of provider organizations need to be asking right now, while we're on that road to recovery. We don't want to say post-pandemic because we're not quite there yet, but we're definitely beyond the crisis management mode of our organizational operations, the changes that we've needed to make as a result of the pandemic, and now how to rebuild. You know, part of our sustainability planning is the rebuilding piece. So 3 questions are: what will the lasting impact of these crises on the health and human service landscape, what does that look like? We should be asking ourselves, how does my organization's strategy and our service lines need to evolve to maintain a competitive advantage and for sustainability? How does our executive team transform our organization to make that strategy a reality and thrive in this new environment? So we're going to touch on all of these things as we go through today's presentation. I think that the strategic implications for what we are calling the next normal, and that's this new normal we're entering in terms of our revised and enhanced business operations, our market positioning, our new growth strategies, given what we've experienced with the pandemic. Some of the big implications are things like integrated care coordination models are preferred by health plans. The pandemic has really accelerated payer interest in working with provider organizations that can provide integrated care models. We're going to talk a little bit about that in a minute. Virtual becomes normal and hybrid becomes dominant. What needs to be done in the clinic, what needs to be done via telehealth, and the growing need and desire for in-home services is certainly something that we're seeing. And substitution of new technologies for traditional services, I think the biggest example of that is the pivoting to more telehealth and virtual consultation for engaging clients and providing services, as opposed to the face-to-face, on-site clinic type services. Facility-based services becoming hybrid. Again, we're seeing this in primary care, the need for more long-term care services being provided in home as opposed to skilled nurse facilities, those types of things. We're seeing more and more addiction treatment services that are being done out of home, really leveraging telehealth and virtual applications like apps and those types of things. Again, as things shift from that facility-based type service delivery models. Price sensitivity and risk-based reimbursement, certainly that the desire for payers to be able to work with providers in more shared risk type models is becoming more and more important, and we'll address some of that a little later on. New competition in the market is part of that new next normal, and certainly the ability for providers to grow or be part of a larger economy of scale to remain competitive is all part of that integrated whole person care kind of movement towards the delivery of services. Sometimes we talk about integrated care services. Whole person approaches is kind of another term, I guess, for the delivery of coordinated care. But again, we've seen growing over the past few years, more and more payers, both public and private, looking for that whole service, that whole person approach, preferably one provider being able to provide behavioral health services, primary care, and coordinating the social determinants or the social supports that complex populations need to stay stable in the community in lower levels of care. Provider organizations, part of that strategy is to be able to figure out how to target these complex populations and develop these new models, will be part of them, whether it be through service line development, strategic collaborations with other providers to create a scale and that model to integrate, to coordinate services that address these issues are all part of that. Andy Kelly talked a lot about this at our institute last year, sharing that Optum, as well as many of the other plans, are really focused on the whole person care approach as a way to provide higher quality care to members and reducing the cost.
Thanks, Richard. We have a quick question here for you. You've talked about integrated care, you've talked about a whole care. Some organizations are afraid that health plans are only interested in new contracts that offer integrated care models. If they aren't positioned to offer that kind of care, what are the other models that our payers are especially interested in?
That's a good question. I think the first thing to think about is if you're not able, as a single provider, able to provide all the elements of an integrated care model, behavioral health, primary care, sometimes that includes SUD, substance use disorder treatment, and the social supports. The first thought that comes to mind for me is, look for a partner in your market that, maybe it's an FQHC that's providing, a health home and primary care services, and how can you provide, bring to the table your mental health services, your community-based case management, to coordinate together to kind of build something that, I don't want to call it a lookalike, but that kind of gets you in that direction. As far as other models, I'm not sure that there are any specific target populations that payers are looking for, but the second part of that is if you can approach a health plan and start the discussion about doing something more on a performance-based, kind of on a risk-based arrangement, some kind of value-based reimbursement arrangement for your core services, that might be another approach to bridging that integrated services conversation with the health plan. As far as where we're at today, it's not all doom and gloom. There are new opportunities out there, despite the barriers and hurdles that we as provider organizations have had to jump over the past 8, 9, 10 months. And part of this idea of creating a pitch deck to get in front of a health plan or a payer. And again, when we're talking, I'm focusing on health plans, but it could be any type of payer, including public payers. Could be county, could be state. This would apply, similarly. The opportunities out there are again focused around chronic, complex consumers that have, chronic behavioral health medical needs. And certainly the primary care market is a market that that has taken a little bit of a hit with the closure of a lot of primary care practices as a result of the pandemic. And the other growing market opportunity is home-based services, again, the result of the capacity issues caused by the pandemic on hospitals, residential treatment providers, in long-term care facilities. And I have a quote in here from Brian Smock. Again, Brian is from Magellan, and he says, and I firmly have been a believer of this for a long, long time, and that is that payers are looking for provider organizations to come to them with creative ideas. And that's the whole crux of a pitch deck. It's about proactively reaching out to payers, public or private, but let's say health plans, and being able to get in front of them and let them know you're here, what your services are, what's going on given the pandemic. You may have new services, whatever, but it really is that proactive approach to let them know what you can bring to them as far as solutions for treatment solutions for their members. So preparing for the pitch deck, there's a couple things that we want to look at before we start the development of that, and that is you want to know your competition. Again, the pandemic has caused a lot of shifts and changes in our market. Competitors may have downsized, your competitors may have closed, there may be capacity issues. You want to know about that as best you can, and maybe highlight some of those service gaps in your pitch deck as something that you're able to provide, or that a market that you want to move into is really important. You don't have to do necessarily a competitive analysis, but just a thumbnail overview of your major competition and kind of knowing how they've changed, are they still there, and are there new opportunities in your market as a result of any changes that they've gone through. Understanding payer pain points. One of the whole idea of a pitch deck is to be able to get in front of a health plan in a language that they understand, with the pain points that they're going to recognize immediately, and in a way that lets them understand that you understand how to work with a health plan, you understand what their needs are. And so things like the list that we put together here are important to know. Health plans are concerned right now because of the pandemic, the results of the pandemic. They're concerned that providers in their networks are downsizing, that there's limited capacity because of COVID. They're concerned that because providers may have limited capacity, or maybe they're not even in existence anymore, that members are going to be increasingly dissatisfied with the plan. And of course, that speaks to HEDIS scores around patient satisfaction. So these are things that are top of mind for health plans. Health plans are concerned that provider organizations understand managed care principles, especially now as they're looking more and more towards performance-based and value-based reimbursement, VBR, models of reimbursement. The health plans will work with those providers that understand managed care principles, that understand the importance of aligning the health plan goals and expectations with the provider goals and expectations, and together, coming up with a contract for services that make sense for everybody. And in the end, health plans are concerned all of these things lead to, or could lead to, members ultimately using higher levels of care. If they can't get the community-based services that they need and they don't have access to them, there's a concern that members might become more clinically compromised and end up in emergency rooms, admitted to hospitals, both psychiatric or acute care, and certainly that's something that is costly to the payers and they want to avoid if at all possible. So we talk about the payer partnership concept statement. I've been referring to it, and throughout this presentation, we refer to it as a pitch deck. It just gets, it's a little easier to say. But payer partnership concept statement is a term that we've used for many, many years, and it's really your statement as an organization to a payer to basically say who you are, what you're all about, your wazoo, service lines and innovations and clinical outcomes, and your interest in partnering with them to expand a contract, to develop a new service line, or to start exploring, continuums of care, for example, that can be paid for under a value-based reimbursement type of an approach. The pitch deck, it's really a tool to be able to get in front of health plans. Maybe it's to introduce your organization if you don't currently have a health plan contract with that plan. Maybe you have a health plan contract and you're interested in rate negotiations, going to a plan and being able to show what you're bringing to the table, from service lines to clinical outcomes to any cost savings, whatever it happens to be, is certainly a feather in your cap to getting their attention to say, yeah, you're worth increasing rates over. And especially right now, we're encouraging all providers to go back and renegotiate your health plan rates. And health plans have been very receptive to that right now. The pandemic has caused an increase in cost for providers in PPE and enhanced technology like telehealth platforms. They understand that, and many, including the public payers, have been stepping up and helping out with increased rates. Maybe you're interested in developing a new service line for a plan. You've identified something in your market that's missing and that you certainly can fill. And your pitch deck can be used as a meeting facilitation guide, meaning once you get that web meeting with a new plan, your pitch deck, which we'll get into right now, really can become your presentation for whatever it is that you're asking for on the list above. And the nice thing, and really an advantage that a provider has when they have a pitch deck and are able to talk with a plan and plan managers, is the ability for the plan to share that pitch deck with other folks in the plan organization. It's very common and happens almost all the time. I worked with a client a few months ago and did the pitch deck, presented it to the health plan. The contract person recognized a certain service line, I believe it was community-based crisis services, and shipped it off to the head of clinical for behavioral health. And now they're considering this provider for a contract for a service that they currently don't pay for. So we want them to share amongst themselves, who you are and what you're doing. The payer pitch deck it's a brief snapshot of the services that your organization offers. It demonstrates your value proposition, and it outlines your proposed health plan services solutions. We're not selling our organization with a pitch deck. This is a lifting of an awareness. This is a bringing in front of them to get your foot in the door type of a tool that we use for developing those initial discussions with payers. And certainly it demonstrates your organization leadership, understands health plans, is managed care savvy, that you understand what the health plan needs are in the areas of, your clinical programs, coordinated care, their desire for, more performance-based type programs and services, and certainly your ability to bring some cost savings to whatever programs you're asking them to work with you on.
Richard, this is Corey. We have a great question just came in from the audience about service lines. It says, how does housing fit into integrated care strategies? Is housing a priority issue for payers?
Well, that's an interesting question, and we have seen, and I know we've published a number of articles. We've seen a lot of health plans that have recognized in certain markets that the housing component is critical to keeping folks, especially clients that may have complex issues, in treatment and stable in communities. Kaiser and Anthem, Aetna, I mean, there's a number of them that are investing dollars in housing, and it's something that is definitely on the table right now and should be brought up to payers when you're engaging them, especially if you think that it's a component that if they reimbursed you for when delivering services to a complex population, a population of clients that maybe have severe mental illness coupled with 1 or 2 or 3 primary care diagnoses, and explore some type of reimbursement for housing. It may even be reimbursement for case management targeting the housing needs for clients in community, helping clients find housing and those types of things. But my answer is definitely it is on the table. It's growing, especially because of the homeless issue that many states are experiencing. So yes, they are open to those things. Organization and service line review. We'll talk about that. So we talked a little bit about that this is not a sales pitch, right? This really is your attempt to demonstrate to the health plan that you understand their needs and that you're ready to have a conversation about developing programs, expanding programs, whatever it happens to be, to meet specific market needs in your area. So payers are looking for organizations that are positioned for new growth opportunities. As I mentioned before, can align payer provider organization goals and expectations with regard to services, to address health plan provider network gaps in specific markets. So they're looking for solutions that address cost and quality issues for complex populations, customized treatment, care coordination, and consumer engagement. I mentioned before, provide organizations that are ready to enter into some type of shared risk arrangement, like value-based reimbursement. And we'll talk a little bit about more as we get into it, but value-based reimbursement could be, shared risk as simple as maybe a case rate, a per member per month case rate for a specific service you may provide. And again, they're looking for provider organizations that have outcomes, that have performance data. It's probably one of the strengths in your pitch deck. If you can show any kind of data that your core services have improved clinical outcomes, have improved a long-term success in outpatient community-based settings, and have reduced the cost of care by keeping folks in lower levels of care. That's what health plans are looking for, and it feeds right into the big HEDIS measures that health plans are focused on. And we don't get too much into that here, but reduced hospital readmissions, reduced emergency department visits, getting patients seen within 7 to 10 days post discharge from an inpatient setting, those types of things. So we're going to get into the components of the pitch deck in a little bit of detail, but right here it's really just kind of an outline of what should be, what we recommend, excuse me, what we recommend should be in a pitch deck. And again, our pitch deck is really, it's not real narrative, it's not real detailed. It's enough so that if I'm a health plan manager, and you've sent me an email and reached out and said, I'd like to meet with you, Rich, that I can immediately look at what you've attached, and it says in one slide, well, here's who they are, here's what they do, here's their clinical outcomes, here's a demonstration of their care management, value-based reimbursement, health plan readiness, and here's what they're asking for. And that's what this is here. These are the things that health plans are looking for. And after I see this, I'm saying, okay, yeah, this is somebody who understands what I need, what I want, what I pay for. They understand what health plans are looking for. So we're going to talk a minute. We're going to talk right now about how we introduce the organization. That includes your mission, vision, and values, what might be stated in there, your unique positioning in the market, a brief description of programs and services, just so they can see your continuum, if you will, of care, the types of specialty programs that you may have, any kind of program innovations that you've created. That's something that addresses the needs, again, especially of complex populations. Maybe you've developed a hybrid telehealth, way of providing patients with outpatient psychiatry through telehealth, and maybe a visit to your clinic once a week or something. I mean, it could be anything. The types of populations that you serve, that you specialize in, again, getting back to the outcomes data, your clinical outcomes, and people often forget that just as important as your clinical outcomes are any data you have around client satisfaction, in any intake admissions data that can reflect timely access to care. Low no-show rates is a biggie for health plans, and anything you may have that demonstrates a reduction in hospital readmissions and ED visits, and anything that's relatable directly to HEDIS measures, that you're addressing the HEDIS, some of the HEDIS measures that reflect high spend types of services like hospitalization and ED visits. A little bit in a pitch deck that demonstrates your ability it demonstrates your understanding of managed care, that you understand and that you're ready for value-based reimbursement type contracts. Those would be contracts that are customer-centric. You've got intake admissions processes that are aligned with what the health plans are looking for. You understand referral network development to generate referrals and manage their members, and anything that highlights any unique program capacity or clinical capability you have are things that we'd want to make sure are in there. So with that, let's talk
Richard, this is Christy. Hi, I just wanted to ask a question that came to my mind. We've heard that health plans, sometimes they offer preferred provider contracts. Can you explain a little bit what that means, preferred provider contracts, and then how would I be able to become a preferred provider?
So Yeah, and that's a question. We get that a lot. A preferred provider, I mean, it has morphed. The definition of a preferred provider contract, I think it's kind of morphed over the years. And it started with managed care contracting, I think, in the early days. But what it has come to mean now is if I'm a payer and I am looking for a preferred provider relationship, I'm looking for a provider that can deliver care and services with, under managed care principles. Now, maybe in some type of a performance-based platform, some type of value-based reimbursement, where I can demonstrate that the programs and services that I'm providing are resulting in a meaningful outcome, usually clinical, that can be, that would lead to some type of cost savings for the plan. And if you bring all of these things, and really that's kind of what this pitch deck is all about. If you bring all of these things that we're talking about, I as a payer am maybe willing to pay you a higher rate of reimbursement because you're coming to the table with these capabilities, with these understandings, with these delivery systems to align with my goals and expectations. The whole idea of the pitch deck is to present your organization to a health plan as a preferred provider. You're asking for a partnership. You're asking for contracts with rate increases, a contract for new services, whatever. As a preferred provider, I'm bringing these things to the table that make me someone that you want to do business with, as opposed to a provider that is not ready for those type of agreements. Thank you for asking that, Christy. So, we usually like to have a slide in the beginning of our pitch deck that goes through, it gives some type of an organizational overview. And again, these tend to be bullet points. We're not talking about real, lengthy narrative type of things. Health plans want to see from an organizational standpoint in 2 seconds, the type of provider you are, you're providing adult services, youth, whatever, your profit status, number of years in business, your accreditation, hopefully you're accredited by someone, and if not, what your license status might be. Annual number of members served kind of speaks to your ability to provide services to a high volume of clients. Your locations, health plans typically want to work with large organizations. You get more bang for your buck. If you're national, that's great. That's what we're looking for. If you only cover half the country, that's still good. If you're in a couple states, then we'd like to see what your footprint is. And maybe you're just in one state and you're in multiple counties. We'd like, your pitch deck should have something in there that at a glance can show them what your footprint is. And then that relates directly to, for them, what the geographic coverage is for their members in a specific market, and where you may be in markets that have high need or various service gaps. Your core program competencies, whether you're a residential treatment provider, maybe you're an outpatient treatment provider that specializes in mental health and drug and alcohol issues. Maybe you're an integrated care provider, and maybe you're already providing behavioral health, primary care, and substance use disorders. These are things that we want highlighted immediately as a core competency. Evidence-based practices, and of course mission, vision, values are all of these things. Some of these things are things we would want to see in a slide or two in the beginning of a deck for your pitch deck. As far as service lines go, the service line description in your pitch deck is designed to inform the payer of your current programs and services. Again, it's just a snapshot. We don't go into much detail at all. We're not trying to sell the programs. What we're trying to do is to inform the payer immediately of what you currently do, so they can get a real quick feel for that. Again, short descriptions, bullet points are sufficient, and we'll get into some examples right now. An example of a service line. Let's say you provide outpatient mental health services. Notice that the bullet points here are very general. BAM, I see I see as a health plan, I can see you're doing individual group family therapy, you work with children and adults, you got 24-hour assessment, you have psychiatry for mid-management, and you're doing case management. Many of these things are billable, commonly billed, reimbursable services for health plan contracts. And so we want it in kind of their language. We don't get into the details of it's outpatient mental health services. We don't need to get into CBT and all these things. We want to really focus on the things initially that we know that they usually pay for and would be interested in. Outcomes tracking and reporting. This is just, I can't emphasize how important being able to have the ability to track and report outcomes is, especially in today's environment, in today's value-based reimbursement type environment. Outcomes is where it's at. Your ability in a snapshot to be able to show a health plan something about your clinical outcomes with regard to treatment programs, how you've reduced recidivism in any level of care because of your programs. I mentioned before, anything that demonstrates long-term success in community-based settings. Your satisfaction survey outcomes, because health plans are very concerned, and it's one of the things that they're focused on as part of HEDIS measurement. Client satisfaction is just at the top of the list for health plans, and anything that you have that can show your client satisfaction, family satisfaction, referral source satisfaction, payer satisfaction are all things that we would want to highlight in a pitch deck. Anything that you have with regard to intake assessment admissions, like your very low no-show rates, because again, it speaks to access for health plans. Conversion rates speak to of the 100 clients that health plans sent in 2020, 95% were converted into some type of treatment program. We don't want to see patients being referred from a health plan to a provider and the client not getting into service. That's a client that may end up not receiving the outpatient treatment that they needed, and may recidivate and may decompensate and end up in a higher level of care that a health plan is going to have to pay for later. So, and I mentioned again about HEDIS, timely access to care, reduced hospital readmissions. Anything around these areas here are things we would want to highlight if you have that type of data that you can share. Your programs, care coordination, service delivery innovations. Again.
Hey, Richard, this is Corey. Can I ask you a quick question? We've had one come in from the audience.
Sure.
Looking at the descriptors of the organization on the list you just presented, the health and community-based settings market space is one where the for-profit and nonprofit differentiation is still prevalent. Do you see this changing or evolving over the next few years, and how do payers view them differently?
So, so the answer is I do believe that the difference is the gap between the two is really closing. I think with the and for two reasons. One, the workforce shortages, just the shortages nationally of mental health professionals and behavioral health services is really driving a sense of urgency for being able to work with any provider organization that can provide services to plan members. And so that for-profit, nonprofit thing, it just isn't as important. The other advantage I think that nonprofit, let's just take nonprofit community behavioral health providers have is, you know, having, let's say I'm a long time community nonprofit behavioral health provider contracted with the local county and state for services, really serving the safety net population. I bring an expertise in managing, you know, complex populations, not only in my treatment services, but in my care, in my case management, in my ability to have field-based, you know, services to keep complex folks in treatment and in lower levels of care. As we shift towards more, as health plans shift towards more, you know, value-based reimbursement type models, those providers are sitting in a nice spot because they're able to bring an infrastructure, an expertise, outcomes, and data to share with the plan to show that they can do these things. And it tends to be your nonprofit folks that are the ones that are have been providing these types of services. So when we're working with health plans, and we do a lot of work with nonprofits, the health plans, we haven't run into any that say, oh, we don't want to work with them because they're nonprofit. That was an issue in the old days. That was a concern sometime, you know, many years ago, but not anymore. Thank you for asking that question. So, you know, back to our pitch deck, you know, we want to highlight any of our programs and services, anything that speaks to your care coordination platforms that have been effective in managing, again, complex populations or whatever population you serve. Service delivery innovations, you know, many programs have created their own approaches to meeting the service delivery needs of complex folks, patients, adults, youth, whatever. And, you know, you want to be able to stand out from your competition, and so you want to be able to highlight those things, you know, to health plans. You know, things like, you know, your expanded telehealth or virtual consultation services that you may be offering now, any integrated or whole person care approaches, having a 24/7 call center or intake and admissions is again speaks to access for members. Strategic alliances with other provider organizations in your market where you on your own have developed you know, strategic partnerships with, you know, primary care, for example, or maybe a drug and alcohol provider, and together you're able to coordinate care and services for you know, a population that may have needs in on all three of those areas. It doesn't necessarily mean that you've merged or acquired a company. It can just be a strategic alliance that you can demonstrate to a plan that together you're able to provide that you know, that integrated approach to service. Anything related to consumer access, anything that makes it easy for plan members to access services, things like website portals, web portals, you know, virtual assessment, anything related to social supports and social determinants are all things that we would want to highlight. Health plan readiness, very important. Again, not to go into much detail, but the ability to demonstrate that you understand that you are health plan ready, that from an organizational standpoint, you have the intake systems, you have the EHRs, you have the ability to track and report outcomes. All of these are things that are really necessary for you know, health plan contracting, especially now as we move more into value-based reimbursement. So let's talk a little bit about the payer partnership concept statement and just kind of get into kind of an example of the things that we talked about. So this is kind of a mock-up of a pitch deck. It's only about 9 slides, so we're going to go through it fairly quickly as we've already went through the components of a pitch deck. But notice on the organization at a glance, it's just some real bam, you know, about the organization, how long they've been around, who they serve, what their core programs, something that a health plan can just very quickly take a look at it and say, okay, great. They've been around a long time. They're nonprofit. They see a lot of clients, and they've got some services here that we'd be interested in. Something that talks to your footprint. This is a footprint for this provider in the county that they're in, where they're located and are able to provide services. It could be, you may have a footprint in statewide or in multiple states. You'd want to have a slide that looks something like that. Remember, when we're talking about service lines, we're not talking about getting into the nuts and bolts of programs. In this example, these are the core service lines of this provider, and we want the health plan to be able to see, what they provide. And probably the thing that would jump out to a health plan here is the residential treatment program. Some of these other things may or may not be things that they may be interested in, or maybe things that we would weave into some type of a value-based reimbursement approach to a continuum of care. It can be your mission or your value statement. Here, for this particular provider, it's what we believe, and it's just a snapshot going down the line, of their values and approach around providing services to youth and families. So again, it's not real detailed. It's just enough for somebody to quickly go through. In this case, they want to highlight their evidence-based practices, which is good, without getting into a lengthy description of those. This is something we want to highlight and say to a plan, we do have evidence-based practices that we use for our clients. We talked a little bit about health plan readiness in the slide before. Here, that's illustrated with just a couple of bullet points. They have operational systems for the clinical aspects of working with a health plan. In this case, they want to highlight that they have a dedicated case management team that knows how to provide coordinated care for continued stay reviews, something that's important for health plans and when working with providers. They want to highlight that they have a robust front-end intake system. They've got the billing and collection systems in place to work with health plans and for billing and collections of deductibles and things for clients. They have an EHR, which is something that nowadays you can't go without. And they have an approach to metrics management. These are bullet points, but remember, when you're talking to a health plan, this is your meeting facilitation guide. You can explain in more detail all of these things that we're listing here. But it's important that they see that you're health plan ready. In this model, in this example, we're looking at what this provider wants to emphasize. Here, they're emphasizing a residential treatment program that they'd like to expand to serve commercial health plan members. And of course, they're highlighting the three big things that are important to payers. We have access to care, immediate access to care, that treatment is short-term, and that there is an approach to discharge planning and aftercare. And the slides go on. There's photos of their campus, which is important for plans to see that for commercial members, for example, you want a nice facility, you want nice pictures of your treatment site. Here again, they're highlighting the things that are important to health plans. Assessment and crisis stabilization. They provide intensive interventions. They do a risk assessment, medical screenings, which are real important now especially because of COVID. The kinds of things that a health plan wants to see immediately about a provider with regard to short-term residential treatment, communication-focused integrative care. They've got full-time nursing, a collaborative treatment planning approach. Again, just bullet points of things that you can get into more detail in when you're actually meeting with the plan.
Hey, Richard.
Yes.
We had a question come in. I want to remind everybody we have about 10 minutes left. So if you have more questions, please send them in. The question we had come in was, do I need to hire a marketing person to help obtain new healthcare contracts?
Oh, the answer is initially, you do want somebody who's kind of your single point of contact, who understands the things that we're talking about in today's presentation in terms of understanding health plan, pain points and what they're looking for, how to package, the things that are important to a health plan or a payer. So you probably have someone on your team that does that. I think the need to hire somebody probably comes down the road, and it would probably be in the form of an account manager, somebody that really their full-time job is doing nothing but working with doing, health plan outreach and engagement, developing new contracts, and then managing each health plan from an account management standpoint to make sure that they're getting their needs met from a payer perspective, credentialing, outcomes reporting, care management, whatever it happens to be. So if you're just starting off, to work with health plans, having at least that one person who has that understanding that can start to get the ball rolling is usually enough. But once you have multiple plans, your contracts in place, the recommendation would be to have a full-time person, because you're going to want a single point of contact to do all of those, build those relationships and manage those accounts. Thank you, Corey. So we're winding down here, so I'm just going to kind of go through again. What we're doing here is we're highlighting the things that are important to health plans. They want to know that discharge planning is robust and it starts early, that we're already working on reentry programming, reentry planning for especially in this case complex children and adolescents, to make sure that they're going back to community and have all the supports they need so that they don't decompensate. They're highlighting again when we talked about some of the innovations, if you will. Here this provider is highlighting that they're seclusion restraint free, which is very important to health plans. They're trauma informed. All the things that we know that health plans are looking for are very simply and concisely presented in this pitch deck. Here, I'm going to go through this quickly here. This is specific to, they're really emphasizing their ability to provide services to complex kids as an alternative to psychiatric hospitalization. So they have a slide here on what the population looks like. Here they're demonstrating in a couple slides that they already have a contract with a large health plan. In this case, it's Kaiser. Any experience you have with other health plans, you want to put in your pitch deck, because again, it demonstrates to a new health plan that you may be working with that you know how to work with a health plan. In this case, they're highlighting the kinds of kids that they're seeing in a pilot that they did with Kaiser Permanente, and gives a little profile. Again, these are all the pain points that health plans have with complex kids that are frequently hospitalized in psych hospitals. So they're putting that out there to show, look, we can manage these, this population. They're putting some outcomes that they've had and during the initial pilot with Kaiser. Again, this shows that you're able to track outcomes, that you're able to achieve some benchmark goals for a health plan. They're talking here about how they're addressing the whole issue of keeping complex children and adolescents, in lower levels of care and out of residential, out of hospitals, with a list here of all the things that, again, that health plans want to see. Just a real quick, a brief slide that talks about their willingness and openness to alternative reimbursement models. In this case, they're already doing a value-based reimbursement approach with, in this case, it's with Kaiser. They're working with a health plan. They've got a two-tiered model, and so they're open to and ready for those kinds of discussions. Lastly, and there's just two slides here, and we'll end our presentation. That's our pitch deck. It's in your colors. It's with your logo. It's with pictures of your, your clients and your treatment settings. But it's just a very quick snapshot of who you are to get the conversation started, to get that door open with a new health plan to say, we would like to meet with you and discuss partnership around a contract, around, a specific service. And I've seen pitch decks that can be, usually they're about 9-10 slides. I've seen pitch decks that are 25 slides. We recommend, shorter is better, but it's whatever, whatever you think you need to do. So, just some, now that you have a pitch deck, what do you do? We would, immediately, especially in today's market with all the changes because of the pandemic, we would encourage you to engage health plans with a solution-focused payer approach. That is, we're not engaging a health plan to sell our programs. We're engaging a health plan to demonstrate that we have solutions for treatment solutions, program solutions for specific populations, and that we're ready to have a conversation about some type of a new contract or expansion of a current contract. Again, payers want to work with provider organizations that bring network value, that understand managed care, that can align payer provider expectations, and that have the infrastructure to be able to move into more of these performance-based type models of care. That's what the pitch deck is all about. Reach out to and schedule meetings with your current health plans. If you've got contracts with health plans, reach out to health plans if you don't have any. Use your pitch deck as a way to make that entry point, to introduce yourself so you can get a meeting with them. You may get to a contracts person. It may be a provider network person. It may be somebody in provider relations at the health plan. It could be business development. Wherever you can get into, you want to start there, and then whoever you connect with will guide you through future, to get that first meeting going. Things that we're asking, when we're doing that needs assessment, here's a list here. Are there any local market provider network service gaps or needs in my geographic area? You're asking these of the health plan. Do they have current plans for network growth or expansion or new contracts? Are they looking for preferred providers or models for specific populations, specific programs? Are they open to talking about value-based reimbursement initiatives? And do they have any interest in contracting with you for something or expanding your contract, et cetera, et cetera? Now that you got the pitch deck, now is the time to get out there and start to use it.
That's great. Thanks, Richard. I would like to end today with a two-part question. And let's say a provider organization recently developed a value-based program for, say, community-based case management for consumers with SMI. The first question is how does an organization convince a payer to pilot that kind of a program? And the second question is, does that pitch change dramatically by consumer type or population?
Good question. And I think your question is right on with regard to the whole idea of the pitch deck is to, for example, introduce to a health plan your organization and focus on the new program the new value-based reimbursement program you developed for, working with the SMI population, and really, customize the pitch deck around that program and new service model. And every time you go to a health plan, you can use this deck, customize it to their needs, to a specific program. But getting that in front of them, making them aware that you have this new model is important to start in that conversation. Health plans don't know who in their provider network does what. They really don't. They don't know that you, as a 5-year contract provider, developed this new VBR program, that you've expanded programs and services. So it's important that you get in front of them, you pitch that, and in the end, in your question, Corey, you're basically asking them, will you contract with me for a pilot? and I've got here's a program description, and I've got all the outcomes and whatever. But that's the whole idea of a pitch deck, is to get these ideas in your organization in front of them so you can start that conversation.
Thank you, Richard. That was great. And as always, you're very informative. I want to thank everybody for coming to today's Executive Web Forum. I want to remind everybody that the slides and the recording will also be available tomorrow. And if in the coming days you have any questions about what we learned here today, you can contact Richard at openminds at openminds.com. Also, please join us next week for our next web forum. It's on Thursday, January 21 at 1 p.m. Eastern. Open Mind Senior Associates Ken Carr and Joe Naughton Travers will present using service line portfolio analysis to maximize revenues and financial performance. You can sign up at www.openminds.com. Look under webinars in the events tab. Richard, thank you again, and I hope to see everybody next week.
Thanks for having me.